Okay, everybody, welcome to the Friendly Neighborhood Oncologist. I'd like to give a special shout out to everybody in the community who wants to immerse in the Oncoverse. And if you're not part of that community yet, please consider subscribing. It's always free. I'll never direct message you. Go ahead and smash that like button, as the millennials say, or just completely destroy it, as they also say. We've got to get the Friendly Neighborhood Oncologist into that YouTube algorithm. I'm a board certified medical oncologist. I actually practice in the suburbs of a major metropolitan city here in the United States. And I practice not far from a top medical school and a top academic cancer center, both places where I did much of my medical training. But on a daily basis, I help patients in the community, and I try to help them kick cancer in the you-know-what on a daily basis. So for our patients, there's a lot of information that's available online. There's also a lot of misinformation online. So what the channel is about is really connecting patients, their families, to standard of care free resources that are available online. So without further delay, let's get underway and immerse in the Oncoverse. Today, we're going to talk specifically about advanced EGFR mutated non-small cell lung cancer. So if we go to the NCCN.org, again, you can sign up for a free account. They make guidelines that are written for patients. They also make guidelines written for physicians. As you can see, the top academic cancer centers all have representation on the committee. And in patients who have been identified to have advanced non-small cell lung cancer, again, the standard of care includes molecular testing for driver mutations. And I'm going to particularly pick the patients who have EGFR mutations, which are the most common out of these molecular driving tests. I'm not really going to comment about the average characteristics of these patients because EGFR mutation can be found in both smokers and non-smokers. However, I always have a higher pretest probability, of course, in patients who are never smokers or very mild smokers who present with advanced non-small cell lung cancer, particularly if they're female, particularly Asian descent. But again, most of my patients in the community with advanced EGFR mutated are not of Southeast Asian descent. And I'm closer to 50-50 male to female, which is a little different than the literature. So EGFR mutation, specifically the exon 19 deletion or the exon 21 L858R substitution. These folks, unfortunately, if they are stage 4, not amenable to resection. I'm just going to put on the emphasize on the guidelines. Category 1, preferred is Osimertinib, also known as Tagrisso. And I will mention that there are other EGFR mutations that are, EGFR inhibitors that are FDA approved. You can also see their level of recommendation. And I will kind of bring up that Erlotinib, Ramucirumab, that combination may be particularly subset analysis has shown before that the exon 21 substitution is maybe an area of unmet need that folks may not previously do that well, at least compared with exon 19 deletion. And the manufacturers of Erlotinib, Ramucirumab are really emphasizing that population. So let's go into the literature, and we'll first start with the Osimertinib in untreated EGFR mutated advanced non-small cell lung cancer. Again, we're talking about patients who have the exon 19 deletion or the exon 21 substitution, the L858R in advanced non-small cell lung cancer. This was the FLAURA trial, FLAURA trial, originally published by Dr. Soria and colleagues in the New England Journal of Medicine in January of 2018. And they looked at patients in a double-blind, randomized phase 3 clinical trial at multiple sites who had untreated EGFR mutated positive exon 19 deletion or exon 21 substitution, and they were randomized to receive either Osimertinib, which is also known as Tagrisso, or a standard EGFR tyrosine kinase inhibitor, such as Gefitinib or Erlotinib. And of course, at that time, Erlotinib would be have been more commonly used in the United States, and at some point in time, Gefitinib wasn't even available on the market for us here in the United States. So this presented the initial progression-free survival data, but the overall survival data were immature at the time that was originally published. So of course, in January of 2020, Dr. Ramalingam did a nice update of the overall survival. And as we can see, the survival in both groups was good, considering that they had stage 4 unresectable non-small cell lung cancer, and they're specifically with EGFR mutations, the 2 classic ones. And the overall survival is good in both groups, but the relative benefit for the Osimertinib group, the hazard ratio for death was 0.80, so 20% relative benefit over the comparator arm. And that led to its FDA approval, and obviously the guidelines listed as a category 1 recommendation. I'm just going to bring up that Ramucirumab, which is a different monoclonal antibody, plus this oral Erlotinib, were also studied in the Relay trial that was published in the Lancet Oncology. Dr. Garone, who is pretty well known in the lung literature, Dr. Luis Paz-Ares, also well known in the lung literature, were all co-authors. This was published in October of 2019. And what they did was they looked at patients with EGFR exon 19 deletion or exon 21 substitution. They did look at pre-specified statistical analysis. Having said that, they were not necessarily powered to show a statistical difference, but they did have pre-specified groups. And I think what's important to remember is that overall, the combination group was better in terms of survival compared with the Erlotinib only group. And there does come with some side effects from Ramucirumab. But in the subset analysis, the exon 21 patients who were thought to be an area of unmet need, they did particularly well. So again, that's a pre-specified analysis, but was not powered to show statistically significant difference. Okay, folks, well, again, this is the Friendly Neighborhood Oncologist. As a reminder, I am not your doctor, so please do approach your own board certified doctor with any questions. Nothing that I say should be viewed as a medical opinion or a diagnosis or recommendation for staging or treatment. Again, this is just a free resource that's available to patients online. And again, to everybody who tuned in to Immerse in the Oncoverse, thank you, and I'm out.